Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday, the 30th of June 21. You'll note that I'm not in my office today. I'm making this recording off-site, so I'm hoping that the video and sound works okay for everybody. The update is that as far as COVID positive patients are concerned, that is patients who are within 14 days of their first positive diagnosis. Today we have 10 positive patients in the hospital, 2 in our critical care unit and 8 on the general wards. That's exactly the same number as last week. And we've one additional patient who is in hospital because of COVID, but is more than 14 days from their first positive diagnosis. I'm sorry to say we've had one further death to record, which takes our number up to 768 since the beginning of the pandemic. That's somebody who's passed away within 28 days of their first diagnosis of COVID. In terms of community prevalence, we've seen a further increase in the numbers across Blackpool, Fylde and Wyre, but the rate of increase has slowed. So for Blackpool, the figures at the moment are 304 per 100,000, whereas last week they were 295 and the week before 199. For Fylde, the figure is 212. That's an increase from 147 last week. And for Wyre, 236, an increase of 161. And the vast majority of patients who are screening positive are under the age of 60. That shows again the incredible importance of vaccination, and the vaccination rates for Blackpool are 77% for adults for the first dose and 63% for full course with the second dose, 85% first dose and 71% second dose for Fylde, and 85% for the first dose and 73% for the second dose in Wyre. Of the 10 patients who I've mentioned who are in hospital with COVID, 7 of those patients are unvaccinated. I can't stress enough that the data is absolutely compelling that vaccination is the key to overcoming this pandemic. So vaccination is now available to any adult over the age of 18 or anyone in an at-risk group. And the easiest way to get access is to go online on the nhs.uk website and follow the link. Very, very easy to get a vaccination, and I urge everybody to do so, please. I think the final thing for me to say is about testing. Very, very easy availability for testing, both asymptomatically, in other words, no symptoms of COVID, but just want to check, perhaps for the purposes of going on a trip or going to work. They are the lateral flow tests, and they can be picked up from all pharmacies. But if you are symptomatic, number one, please do not go to work. Please get a PCR test done first. And the symptoms of COVID, just to remind ourselves, fundamentally are a high temperature, a continuous cough, or a change or lack of a sense of smell or taste. Those are 3 still classic symptoms. And if you have any of those, please, please do not go out into the public or go to work. Make sure you get a PCR test before deciding what to do next. That is so, so important. So finally, the numbers look like they are levelling off for the Fylde Coast. We need to keep on top of that. We need to complete the vaccination programs for all adults. And please remember the standard advice around hand washing, around social distancing, and around wearing masks in public places. Thank you so much.